Most older adults view driving as essential for their independence, but what happens when driving becomes unsafe? I'm Kathy Clinton, your host of Age Better Resources, and I'm excited today to be talking to Terri Cassidy, owner of Health Promotion Partners, a therapy company here in Colorado, about their specialized programs to support older drivers. We'll also hopefully get some expert advice from Terri for individuals and families who are wondering how to handle driving concerns if they're trying to do this on their own. Welcome, Terri. Thanks so much for taking time.
Thank you for having me.
Yeah. To begin, can you provide an overview of your company? I know you offer a range of services.
Sure. Yeah. So we provide occupational and physical therapy services. The driving program, which I'll talk more about, is a big part of what we offer. So all of the driving services are provided by occupational therapists who are also specialists in driver rehabilitation. But in addition, we offer OT and PT services in the client's home. So kind of this model of mobile outpatient, but it's considered outpatient therapy in terms of Medicare. And then some dementia-specific programs geared toward caregivers of people with cognitive changes.
Awesome. And can you describe how age-related changes, either in health or function or both, can impact our ability to drive safely?
Sure. There's a lot to say about that. And I think I'll start with kind of the ones people are more familiar with, maybe. So I think a vision is an easier one to talk about. Oftentimes, not always, but oftentimes people are aware of vision changes. And this could be age-related or not. But an easy example would be something like cataracts, where somebody's vision, especially night vision, is more cloudy or they're more affected by glare. And so I'll talk to people who are on their own reducing their driving at night because they just feel like they can't see as well at night. And cataracts is a nice one to talk about because there's also cataract surgery. So there's something that can be done about that. If it is impacting someone's driving, that's kind of a reversible cause, which is always nice to find. But just age-related changes in vision could be visual acuity, it could be contrast sensitivity, so that I'm not able to see as well at night. Or there could be more medical things with someone's visual field, or things like that. So vision is a big part of how we take in our information for driving. So that's something that we all should just be aware of and talk to our eye doctor about, see our eye doctor on a regular basis. Physical changes are varied as well, but kind of the ones I think of off the top of my head would be things like range of motion. So being able to turn your neck so that you can check your blind spot, looking over your shoulder. Sensation is a big one. So we see a lot of people who've got some numbness due to neuropathy, maybe due to some other disease process where they just can't feel the pedal under their foot very well. Or some people come to us because they're having trouble, and usually they find out in not a great way, but they press the gas instead of the brake, for example. So they can't quite feel which pedal they're on, and sometimes it just takes once to do the wrong one. And then
that would be terrifying.
Alternatives.
Yeah.
So we like to see people before any of those things happen, if we can.
Yes. Well, and that range of motion, I know when I've had injuries and can't turn my neck in the same way, it really makes it difficult to be so much more careful driving. Yeah.
And there are things, even arthritis affects a lot of range of motion, and it could be even like gripping the steering wheel or pain with certain movements or things like that. So there are things that we have suggestions for, or that we can help somebody work around. The ones that are sometimes harder for the driver to notice would be cognitive changes. And so that can be a variety of things. The most common thing that maybe family members notice is memory. So if someone's having some difficulty with memory, they're often wanting them to come for a driving evaluation. And oftentimes the client themselves is saying, well, remembering names doesn't have that much to do with driving. And so it's helpful to come and we do the full evaluation and really look at, like, is it just a specific thing of remembering someone's name, or other aspects that are being impacted? That memory piece, is sometimes tied to just increased distractibility, trouble like making quick decisions, especially when there's a lot going on. Sometimes tied to remembering how to get places, which is really my biggest concern with somebody with memory loss, is that they will get in the car and start driving and just keep driving because they don't quite remember where they were headed. And so they're like, oh, but I like it over here. And I've actually been in the car with somebody when that has happened. So I'm sure it's different for everybody, but I was with a gentleman and he was going to drive me to the place where he plays tennis. And we drove. After a while, I was like, where are we headed? He's like, oh, I thought you wanted to go to the mountains. And so he was driving up toward Cheyenne Mountain. And
My goodness, yeah.
it was just interesting to see his
Yeah.
driving skills they were still safe. It was just this overall awareness of the goal of what we were doing.
Right.
So
Yeah.
those are, sometimes it's family members, sometimes it's medical professionals that are recommending someone have their driving looked at if those are issues.
Yeah, makes sense. So can you talk about your driving programs? Because I know they're kind of different focuses, is my understanding.
Yeah, a little bit. I mean, ultimately, all of our driving services start with a comprehensive driving evaluation. So kind of regardless of the reason you're coming, they would all start with that. So I'll just describe that briefly. That's a 3-hour session. The first half of that is in our clinic. So we're looking kind of at all these things I just described. We're looking at those things, doing standardized assessments for different aspects of vision, for different aspects of sensation, strength, range of motion, and also thinking skills, memory, cognition.
Yeah.
So that we kind of take those results, go through them, talk to the client about what we see at that point, and then go out and drive. And so we always drive in our vehicle, which some people are very disappointed to hear about because they really like their vehicle.
Right.
But we do use ours because we have a brake on the passenger side.
Okay.
We have some extra safety equipment, some extra mirrors, some things to make sure that we are all safe. So we're required by the state to use our vehicle for the eval, but we always just start out in a neighborhood, make sure somebody's comfortable before we start any assessment pieces. And then come back and really talk about how the kind of clinical testing and the behind the wheel testing match up, kind of what our recommendations are. We love to have family in on that conversation and kind of discuss. And so in terms of the different types of programs, we might see somebody who's had a recent medical event. So we see a lot of people after a stroke, for example, where maybe their doctor has asked them not to drive for a certain period of time or not to drive until they have an evaluation. Or sometimes the person themselves or their family is just saying, let's make sure that you're ready to go back to driving. But then we also see people who are currently driving and it's more the family that is, again, wanting to make sure, is this still safe for my dad? Maybe a license renewal is coming up and they want to make a decision before that happens. Or again, it could be a recommendation from a neuropsychologist or a doctor that's recommending that driving could be impacted because of what's going on with them.
Yeah. And how much resistance is there? I know the thought of losing your ability to drive can be really scary. So do you see much resistance with people coming in? Or I suppose if there was too much resistance, you wouldn't ever see them. So
I know that's what's hard, is that, right, the people we see have, they're not always here willingly, I would say. They're not as excited about coming to us. But they are the ones who agreed to come. So I think it is a really touchy subject. And so even if it's a medical event, I mean, we've seen people after COVID and they've just kind of had a prolonged medical event and they just haven't driven in 6 months. And so that kind of brings up this topic.
Mhm.
Even the people who feel really confident coming in, I would say everybody's a little nervous, right? Like it brings
Yeah,
back
of
memories
course.
of your 16-year-old driving test or any of that.
Yeah.
But
Yeah.
the biggest thing I think is just realizing that we are here. We're not a licensing agency. Like we are here from a therapeutic perspective and really trying to help our clients move forward in the best way possible.
Mhm.
So a lot of times, probably 100% of the time, our client's goal is to keep driving. And maybe
Mhm.
that's just to the grocery store and back. Not everybody needs to be on the interstate. Not everybody wants to return to driving at night, for example.
Mhm.
Um, but our goal is to really help people continue their independence in ways that are the safest for them and the community.
Yeah.
So I would say it's our front office staff that talks more to family members about how to help a loved one agree to come and to see us. And it really varies. I think for some people, they're motivated by saying, my daughter is worried about me. I'm just going to go. So we're all on the same page and she won't worry anymore. Like I know I'm going to do fine, but I'm going to go and just prove it
Yeah.
basically.
Yeah.
Um, and so that can be helpful.
Mhm.
Um, or just this idea of just, I want to make sure I'm safe. And so
Yeah.
I think a lot of people end up coming from that perspective too.
Right. Well, and I think also the piece that you can perhaps help them stay safe and keep driving longer is could be really helpful in people coming in and looking at ways that they could be safer. So what
Yeah.
are some of the things that can be done if you notice certain situations that maybe would there be modifications to the actual vehicle that could be made, maybe additional mirrors you mentioned in your car, or what
Yeah.
are those
Yeah. Thanks for
options?
bringing that up too, because I feel like I don't know the current statistics, but it's something like 80% of the people who come see us pass. So it's not like we're just a place to come to lose your license. So we're
Right, right,
certainly really on this approach of helping people maintain their independence.
right. Hmm.
Um, some of the features, some of the vehicles can be modified. Well, pretty much all vehicles can be modified for certain physical disabilities. So, for example, if we see a lot of people who maybe have a trouble with arm function after a stroke, and sometimes their foot is doing pretty well in terms of recovery and going from gas and brake, but
Hmm.
but steering isn't great, or maybe getting to the turn signal or things like that. So there's some pretty simple things like a knob on the steering wheel to help somebody steer with one hand.
Oh, yeah, I've seen that.
They're
Hmm.
kind of people are like, aren't those illegal? And yes, but we can help you get it added to your license so that it's legal.
Oh,
Um,
interesting. Okay.
there's like turn signal crossovers. So just to extend the turn signal if someone's doing it with their right hand, for
Yeah.
example.
Yeah.
And then we do things with more involved vehicle modification. So we work with people who need to switch from driving with their feet to operating gas and brake with their hands. So using hand controls. Maybe that person had an amputation. Maybe
Mm-hmm.
they have MS and they're just having trouble coordinating the movements with their right leg.
Mm.
Um, a lot of times that can really just bring someone back to where they were feeling great about driving and they were trying to minimize it.
Yeah.
Um, and
That
then we can
would
get
be
them to
hard
where
to
they're using something.
train, right? Sorry for interrupting, but I was
Yeah.
just trying to picture that would be a hard thing to train yourself to drive in such a different way. So your therapist will work with someone to help them train to do that. Yeah.
We do. So that's not just a one-time
Yeah. Yeah.
appointment. That's true.
So, yeah.
Um, and I do feel like so many of the people that we see who are switching to hand controls are really kind of hesitant about it until they go out and try it. And then they're like, oh, that wasn't as bad as I thought it would be. And I think some of that is they were pretty nervous about driving with their feet to start with. And
Mhm.
so when they're driving and they can actually feel the pressure on the gas, feel the pressure on the brake,
Right.
um, that confidence comes back.
Yeah.
But we do training, and then we do a final fitting once that person's vehicle is modified. So we'll drive with them in their car. So we do kind of make sure that everybody's got it all down
Yeah.
before we send
Oh,
them
that's
away.
interesting. Yeah, I didn't realize you guys did that also. So I know the occupational therapists are the ones working with individuals. Is that correct?
Yes.
Yeah. So do they receive special driver training? Yeah.
Yeah, there's kind of this, it's a pretty small niche area of occupational therapy.
Mhm.
There's a national organization that does a certification process for medical professionals. You don't have to be an occupational therapist to be certified as a driver rehabilitation specialist, but
Mhm.
we all go through a couple weeks worth of coursework and training, and then a full year basically of on the job training and treating clients before you can sit for the exam. So
Great.
to be a CDRS is a additional commitment, but
Yeah.
really important one.
Yeah.
And so kind of for that reason, there's not very many of us in the state. I think there's 12 OTs who are certified driver rehab specialists in Colorado.
Okay.
Uh, so it's maybe that's part of why people don't know about us so much, because we
Great.
need more of
Great.
us.
Yeah. Yeah. I didn't realize the training is that extensive. Yeah. That's terrific, but it's so important. So
Yeah,
then with that specialized training, are these services covered by most insurance?
good question. And sadly, no.
Oh
Um,
my gosh.
Generally, the general answer we get is that Medicare doesn't see driving as medically necessary. So
Mm.
even though occupational therapy services are covered, just not anything an OT does is covered. So
Yeah.
um, that's kind of the Medicare standpoint on that. And most other insurance companies go by Medicare's ruling there or
Yeah.
decision.
Yeah.
So we have really tried to find other funding sources.
Mhm.
A lot of clients we see are paying privately for the
Mhm.
evaluation. So
Yeah.
for the 3 hour evaluation, it's $480.
Mhm.
We do have like a couple of contracts with like Rocky Mountain PACE. So if somebody's involved in the PACE program and
Mhm.
they're identified, then the driving evaluation would be covered.
Mhm.
Also with the veteran, with the VA. So if we have a veteran and they're referred through their VA provider, then the driving evaluation would be covered. We
Mhm.
have some grant funding through the Area Agency on Aging,
Mhm.
limited, but super
Mhm.
excited to
Yeah.
have that as an
Something.
option.
Yes, that's great.
It's
Okay.
helpful. And
Yeah.
then there's a couple like diagnosis specific foundations and things like that. So I always tell people just to call our office and we will do
Mhm.
everything we can to help you get what you need.
Yeah. So you guys really have to become specialists in funding this type of service, which seems like such an important just health public safety service. It's unfortunate, yeah, that it's not just covered.
Yeah.
So I know you said there are not a lot of people specializing in this. What areas do you guys serve in Colorado?
Yeah, so we have offices in Colorado Springs, in Westminster, and in Fort Collins.
Mm-hmm.
But in terms of areas, so primarily we people travel to us for the evaluation.
Mm-hmm.
Um, so we end up working with people from all over, all over Colorado. But our Fort Collins office, we see people from Wyoming,
Wow.
in general, even Kansas and Nebraska. People end up at our Denver location. So it's been interesting
Yeah.
that there's just not enough services out there, and people
Right.
will travel.
Yeah. Okay. So if people from a totally different area wanted to look for a similar type of service, who would they call? Or yeah.
Yeah, my recommendation, I mentioned the National Association for Driver Rehab Specialists. So it's
Mhm.
ADED,
Mhm.
ADED. Um, if you go onto their website, so aded.net, there
Mhm.
is like find a specialist tab at the top. And so that's kind of I think it's even international database. So that's a great place to start if you're looking for an evaluation.
Mhm.
Um, that's
Yeah.
where we always refer people if they're out of state.
Okay, that's good to know. Yeah. So is there anything else that you can think of that we didn't talk about that might be important for people to know about this?
Hmm. There's a lot. There's a lot to talk
Yeah,
about
there's
with
a
this, and
lot.
I
Yeah.
think the one thing I would like to just mention is that we really encourage people to come do a driving evaluation
Mhm.
earlier on along in their process. So it's really great if we can get kind of a baseline. So maybe someone has a diagnosis of mild cognitive impairment,
Mhm.
um, but they feel like they're still driving fine. I feel like that's a great time to come get kind of any tips that we may be able to offer.
Mhm.
Um, and then we can kind of stay in touch if things progress. And so I think something we talk to a lot of families about is kind of this hybrid model. So we touched on a little bit in the beginning that it's really painful to stop driving. And it would be for any of us if someone just all of a sudden today said, today's your last day that you're going to drive.
Right,
And it
right.
feels like it's out of the blue and you don't know why. And so I think coming for driving evaluation helps open up the conversation of what could happen in the future. You
Mhm.
know, hopefully everything went well today. These could be progressions. And sometimes that's a start of more of a hybrid plan toward transportation. So by that, I mean that person maybe is still driving, but on a more restricted basis, and then involving Lyft or Uber or the bus at the facility where they live or a family member for trips maybe further than 5 miles away or things like that. So I think being
Yes.
able
Yeah.
to kind of transition over time is
Yeah.
what I would ideally love to see.
Yeah. Yeah, that makes sense. And like so many things, having an earlier conversation when it's not a threat of something happening imminently is more comfortable because then people might be able to have a more rational conversation without the emotion about I talk to families a lot about having conversations about what people's preferences are in the event X might happen. It might not, but what do you think now would be a good plan for that? And what would you want us to do to help with that? And sometimes people are more comfortable looking at it when they're not under that immediate threat of they're going to move me or they're going to take my keys now,
Yeah. Yeah.
right? Yeah.
Yep. I totally agree.
Wow. Well, good. Well, I will include, is it best for people to reach out and call your office, or what's the best way for
Yeah.
them to learn more if they are in the Colorado area or neighboring states? I hadn't even realized that.
Certainly. So our website is a great place and there's a lot of information there. So we're healthpromotionpartners.com.
Mhm.
And then or just call our office. We have two fantastic admin staff that really just take their time. They understand that this is a complex topic and are just really good at helping people navigate. But
Right.
there's a lot of pieces to it.
Yeah.
So our phone number is 719
Mhm.
231 6657, and that would be for any of the offices. We kind of can handle everybody from that one number.
Okay, perfect. And I'll include that with the notes.
Thank you.
So, well, good. Well, Terri, thanks so much for taking time to come and talk about this important topic. I appreciate it, and I appreciate all the extra effort you had to go through to be able to offer this obviously much needed service.
Awesome. Thanks so much, Kathy.
Thanks.